Hi, everybody. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless you forgot to retract your adamantium claws before going to the bathroom, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi everybody, I'm Jackson Vane.
I'm Johnny Kolosinski. You might remember me from such podcasts as We're Recording Twice Today and I Didn't Come Up with a Second Joke.
Boo.
You might remember me from such podcasts as Willikers, a Wizard People Dear Readers fan cast. There we go.
Better.
This is Hi Everybody, a bad medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine, how the body works. With us this week is Dr. Courtney Nicholas, who has been on the show quite a few times before. This is what, 5, 6?
Hi everybody. I don't know how many times it's been, but I will say it's the first time that I realized that you make up a podcast every time.
And Dr. Nisha Shah, who is either with us for the first time or the second time, depending on when I edit and release this episode.
Hi everybody, this is Dr. Nisha Shah. Thanks for having me.
Yeah, you introduced yourself on the House episode that we will be discussing before or after this one. But briefly, your specialty is?
Allergy and immunology, and I'm happy to lend my expertise.
Yep.
You can find this podcast online at hieverybodymd.com or on Facebook, Instagram, and Twitter at hieverybodymd.
And you can also call us at 530?
Yes, 530.
Doctorb. I've had too much podcast juice. The B stands for, boy, that was a lot of podcast juice.
I was going to go with the B stands for Bel Air, because we're going to be talking about one specific scene in 2005's Hitch.
Yes. If you haven't watched Hitch, Will Smith is a date doctor who tries to set up not great guys with very beautiful women.
Oh,
It's the most
great guys.
2005 movie ever.
Well, Kevin
It's
Smith...
basically, it's pickup artists.
It is the pickup artist kind of thing, except he's not the pickup artist. He teaches people how to be a pickup artist.
Like the game. The game was like... well, I lost the game. But the game was this book on how to pick up women that was, like, very, like, with peacocking, where you wear the big hats. It's insane, but this is what people thought was how you meet women in 2005.
Is that the one with the negging and stuff?
Yeah.
Oh.
Yeah, it's awful.
Nah.
It's awful. But this is not a relationship advice podcast.
Especially a bad relationship advice podcast.
Yeah,
No, but we're going to talk about one specific scene in Hitch.
Mm-hmm.
And it's the one where he goes on a date with Eva Mendes. And they go to a cooking class?
Yeah, they call it a culinary rave, which again is the most 2005 thing I've ever heard.
Fair. Touche.
And they're learning to cook a thing and being served a thing.
Yeah, they get served a lettuce cup of some sort with a bunch of food in it, and then Will Smith eats it and starts making like obscene throat clearing noises.
Yeah.
I'm
And
hungry already.
when we talked about doing this episode, Nisha was saying that this is something that whenever someone comes into her office, they say, I looked just like Hitch.
Yes, I can tell you more often than not, every week at least, when someone's been referred to me trying to describe why they're in my office to determine what they're allergic to, they're like, Dr. Shah, I look just like that Will Smith and Hitch. My ears were swollen up, my lips, my nose, I couldn't breathe, I was clearing my throat.
Do they say it exactly like that?
Exactly like that. If not, maybe I'm Dr. Shah embellishing, but it's more throaty like that. But the movie actually, timing-wise, shows it very realistically in the sense that he has no idea what's happening when he eats something that he's unfamiliar with, which is very common when someone doesn't know they have an allergy to something. Now,
Because a beautiful woman feeds it
exactly.
to him.
Right.
We have no idea if he knows he has a shellfish allergy or not, but fun fact, most shellfish allergies are diagnosed in people's late 20s or 30s, very much not a childhood food allergy. And so in this movie, what Will Smith is experiencing as his character is very common. So
you did mention that it usually takes like repeated exposures.
Exactly, it does. Most people have probably had this food multiple times and not had anything happen, and then all of a sudden they have a reaction. So I don't know in this movie if Will Smith knows he has a shellfish allergy and doesn't know what he's being fed, or if he has a new onset allergy. It never becomes clear when you're watching the movie, but the reaction that happens is very clear and very much allergic.
When they describe the food, it's like a St. John's croquette with a balsamic reduction or something like that, where you would have no idea what you were eating if you didn't know exactly what you were eating. I don't know exactly what they describe it as. Jackson, you have a shellfish allergy, correct?
My face puffs up.
Yeah.
Nisha doesn't believe me.
I totally believe you.
Well, what you need to do is you need to tell her that you look like Will Smith and Hitch.
That is actually how I looked the first time I had it.
When were you first diagnosed? Or when did you first have a reaction?
When my family served me seafood from our family business. But I was like a 9 or 10.
That's so sad, Jackson.
I'm bad Asian.
Jackson, his background is very much from a background that eats a lot of seafood and shellfish, right?
Correct.
So that must have been really hard for you.
It was fun.
But you knew at an early age that you had that food allergy, right?
It's when my face puffed up pretty bad and my ears puffed up. Like Hitch.
Mm-hmm. Just like
Yeah.
Hitch, right?
Wait, when you say that generally a shellfish allergy is something that doesn't occur until, or doesn't show up until later in life, is that generally because when you're a kid you're a picky eater? And this is me, giving correlation versus causation.
No,
here.
it's hard to say that maybe the case very much, because a lot of children avoid fish and shellfish. I mean, just because it's just kind of weird, right? Like they don't want to eat it.
8-year-olds get lobster twice.
Right, exactly. So you're right. That may play a role population-wise, why we statistically see it more in older adults. But culturally, like in Jackson's case, his family eats a lot of fish, a lot of shellfish, so he may have found out at an earlier age than others that he was allergic. But it's hard to say, because I do see a lot of patients who grew up eating shellfish, eating fish, and then all of a sudden in their 20s and 30s have a shellfish allergy. So it wouldn't be surprising that in the movie, Hitch has no idea he has a shellfish allergy, which is what I always believed when I first saw this movie. He has no idea, and he just eats whatever he wants and then has this reaction. But it's possible that he knew and he just was distracted by his date and didn't know to ask what he was being fed.
To be fair, you would be distracted by Eva Mendes.
Right, I would be too. So
and probably eat whatever he fed you.
Exactly. So it's hard to say in this movie. And that was the question I was asked. I was like, I have no idea if he knows he has it, because he never mentions it in the movie.
His reaction to it is not.
It's very surprising.
It is not.
Yeah,
I'm having an allergic reaction.
He doesn't know.
To go
Right.
get. I need I need to go to
You're
the
right.
ER. I
You're
need
right.
an EpiPen. I need Benadryl.
Yeah.
Whatever. It's.
Yeah.
I will say it's kind of interesting that they only went for the Benadryl.
Yeah. Yes.
Well, none of them were doctors.
But in his defense, if he's never had an allergic reaction before, he didn't know what to do, right?
That's true.
But Jackson, if you were in that situation, you were with Eva Mendes, you would have eaten it, even if you knew he had a shellfish allergy because she's hot and you wanted to continue
call
on.
911.
And you realize, she fed me something with shellfish. What would you do in that situation, Jackson, as a doctor and as a known shellfish allergic patient? What would you do?
Benadryl and then EpiPen, but also call 911 if I'm having difficulty breathing.
Yeah.
But I don't know. He never really made it.
Would you have had your EpiPen with you?
I probably should.
But
Do you have one?
Nope.
Really?
Because I'm a bad doctor.
I was gonna say, is it expired? Was gonna be my next question, but no,
Bad
because
doctor.
it's non-existent.
when he was clearing his throat, would you have given yourself an EpiPen?
How was he doing that?
I'm just looking at
I'm
how
gonna-
much it spikes up.
That was the point. But
I'm just gonna make a new rule on the podcast that we don't make that sound.
okay, fine.
Once more.
Once more.
Once more for good measure. But yeah, I think if you were the first time like this person, Benadryl is what you're taught, right?
That's what you're taught, yeah.
allergies. Chugging that much Benadryl though, Not good.
Not good.
I learned from Jackson on a non-episode, just conversation, that is it Benadryl psychosis or something along those lines?
It's like you drink enough, you get anticholinergic symptoms. So the way I was taught of what it's like is you're mad as a hatter, so you get psychosis. You're dry as a bone, so you stop sweating, you stop drooling. You're hot as a hare, and then red as a beet. It's like very poetic.
Was this
remember.
written in like 1884?
I don't know, but that's what we were taught about that toxidrome. So if you drink that much Benadryl, even if it is children's Benadryl and you're drinking it like a sippy cup, you get really, really out of it. Like we'll get kids that overdose on Benadryl and they come in completely floridly psychotic but dry as heck. And usually if you see that, you know that they are very intoxicated, very psychotic from this overdose and not this pleasant drunk that Will Smith was.
Well, and children can have that reaction even if it's not an overdose as well. You hear about parents, taking their child on a plane for the first time and, oh, it's okay, I'm going to drug them with Benadryl. And that child is screaming bloody murder the entire flight, which is not the outcome that parents were looking for.
I mean, that's why we tell parents to try it at home before you get on the plane.
Not medical advice. Don't drug your kids at home either.
Yes, but if you were to try Benadryl, trying it at home is better than being stuck in a tube.
Hurtling through the air.
30,000 miles an hour.
Very much have an adverse reaction.
Yeah, it's bad. When kids go reverse Benadryl, it's not fun.
Never go reverse Benadryl.
No. People give it to their dogs, too.
Did we give it to Ted Cooper?
Yeah?
Yeah.
Ted Cooper's their dog.
Does he like it, or does he go crazy?
He goes naps.
That sounds pleasant right now.
Well, let's finish this podcast, and then we can nap.
I'm trying to think if there's anything else.
Well, so just like the quick physical symptoms, he's clearing his throat as Nisha demonstrated.
So
Did
classically, Hitch, this movie depicts an allergic reaction very, very well. So you get the, which we're never going to repeat on this podcast ever again.
What sound was that again?
And then he has,
Thank you.
I would say cinematically the best depiction of angioedema, which is the swelling of the deeper tissues of your skin in an allergic reaction of the ears, the lips, and the nose and the face. Like, I mean, if I ever have a question about somebody coming to me in the office depicting an allergic reaction, I will often hear, I looked like Hitch in the movie, Dr. Shah. Like, I looked like Hitch.
Do you ever ask them, did you look like Hitch?
Yes, and in
Is
fact,
this a real
and in
consult?
fact, do you have a picture?
Show me. Prove
Show
to
me.
that you looked like Hitch.
Yeah. You don't have to prove to me, but sometimes they'll be like, I think it was an allergic reaction. I'm like, have you seen Hitch? Did you look like him? And they'll say, no, not that bad. And I'm like, okay, but what did you look like? What do you mean not that bad? I'm like, it was just one ear. It was just half the nose. Or it was like
Did you
half
make that
my lip.
sound?
No, I never make the sound. That was just for the podcast.
I hate to say it, though, too.
I mean, cinematically, though, beautifully done. I would say
it was really good makeup.
one of the
Yeah.
best cinematic depictions of an allergic reaction.
It is a little harder to reference that to our pediatric patients now because
yes,
this
it
movie
is.
was made
It
before a
is.
lot
It was.
of
It
them.
was.
Yeah,
Yes.
I can
So
see
my
that.
patients, I do say that I do see adults as well. So in my specialty, I see adults and children, and is almost always 35, 40 years old, like over, that will reference Hitch because it is 2005, right?
Yeah, that's
Yes.
a 15-year-old movie. This movie is almost old enough to drive.
Isn't that sad?
That's sad.
And you start referencing movies and it makes you feel really old.
Yeah.
Did I told you guys my kindergarten cop story, right?
No.
Yes, I have heard this.
Yes.
The audience is not.
I was teaching some medical students. This is completely off topic from the movie Hitch.
Don't care.
But I was teaching some medical students about babies. You know, I take care of babies, and we were examining a child, and I asked them a question because when you teach medical students, you ask them questions to try to get them to solidify their learning.
Pimping
So
them.
I asked, it's called pimping them, yes, which means put in my place.
Yep. I think we touched on this.
Yeah,
Did we
a couple
touch on this?
times.
I wasn't
Yeah,
ready for that one.
we've touched on pimping. a
So
few
I
times.
asked the medical students a question, and one of them responded with, is it a tumor? And everyone's hands in the room are in their face right now because the medical student's response was, is it a tumor? And I responded, it's not a tumor, in my best Arnold Schwarzenegger accent.
Which was
A wonderful, in my opinion, wonderful throwback to the movie Kindergarten Cop.
We won't know until we hear it.
Yeah.
I'm not going to do it.
You have to do it,
Not
Courtney.
going to do it. And I responded to the I almost said child, to the medical student, it's not a tumor, in my best Arnold Schwarzenegger accent.
That's a horrible
Not good
accent.
enough.
No.
And there were three medical students. We were all learning together, and the three of them just stared at me.
Well,
Like
we
I
would stare at
was-
you too if you didn't say it.
And I said, it's not a tumor. And I looked at them and I said, you know what? You guys are too young for this. I'm done. We are not learning anymore today.
No school for you.
No
Which
school
is
for
also
you.
too old for
No
this.
soup for you.
That is
Exactly.
way too old. That is about the same time as kindergarten.
Yeah,
It
and I think
was,
it's a little later.
It hurt my soul.
So, I have an important question to ask.
Ask Nisha first.
Yeah.
The human centipede bills itself as 100% medically accurate. If that's the case, how medically accurate is the allergic reaction scene from 2005's Hitch?
So the
Baseline?
the allergic reaction scene in Hitch, I would say it involves assuming that Will Smith has no idea he has a shellfish allergy. I would say 80% accurate because, I mean, if he
Remember, it's to the human centipede.
Okay.
Yeah,
fine.
yeah. The human centipede is our baseline. That's 100. It's a movie
Remember-
about people sewing sewing faces to butts.
Thank you, Johnny.
Oh,
Human
okay.
centipede.
So I would say probably 100%
Just as accurate as the human centipede.
because we're assuming he does not know he has a shellfish allergy, which makes us presume he doesn't have access to epinephrine, which if he did, he
Or
should have
shellfish.
used his EpiPen immediately on the fact that he was clearing his throat. He couldn't, his throat was swelling, like he couldn't breathe, he couldn't talk. But his date took him appropriately to get some antihistamine, which would alleviate the immediate itching and swelling, but it wouldn't save his life and raise his blood pressure and clear his throat. So, yes, then I would say maybe 100% as accurate as the human centipede. Although I have not seen the human centipede.
How have you not seen the
I
human
know.
centipede?
I didn't see it until we
We might
recorded.
need to rectify
I feel
that.
like I can't do this podcast until I've seen this movie.
I'm gonna go with 150% accuracy because Guy was trying to impress the date.
Yeah,
Let's be
I'm
honest.
gonna agree with Courtney on that one.
The movie was accurate.
Yes.
Yeah, no,
Yeah.
we're saying it is accurate.
Yeah,
we're not saying it's not accurate.
It is.
it is accurate.
0.5 times more accurate.
My threshold is very high.
The human threshold, or human
Human
centipede's threshold is less high.
The human threshold centipede is
Human,
quite high.
yeah, the final threshold.
Can we
Yeah.
stop talking about the human centipede?
Never.
No,
please?
never.
No, that is something we're going to talk about forever.
I get visuals every time we do it.
I just
love
remember that subtitle.
Oh, that's
Splashes.
splashes of the subtitle.
No, the splashes in the subtitle. Jackson,
Yeah.
as someone who has both seen the human centipede and has a shellfish allergy,
Yeah.
how medically accurate?
No, I told her.
He agreed with
I
me.
think you agreed. Oh, 150
Yeah.
also? Okay.
Any way you would increase the stakes to make this look more realistic, Nisha? Or do you think it works?
Oh, I mean, to make it more realistic would be if in that restaurant setting where they're serving shellfish, somebody in the
He
restaurant
dies.
had an
He
epinephrine.
He dies. Will Smith
No,
dies.
the epinephrine auto-injector. Like, so if the wife of Eva Mendes' colleague was like, you're having a food allergic reaction, and she may or may not have understood that and had an EpiPen, or if she asked the restaurant, which a lot of restaurants now will have Epi in their, at least Starbucks do, and other places will have epinephrine, and she would be like, does anyone have an epinephrine pen? And shout that. And she would have given it to him because she clearly recognized it was a food allergic reaction. That would have given me, like, I would have been like, awesome. That is kudos to that character in the movie.
But then you lose that whole fun.
I know. Then you would have never had the lip swelling, the ear swelling, the nose swelling, the clearing of the throat. None of that would have ever happened. And yeah. Or if Will Smith like had an EpiPen on him, if he knew he had an allergy, which we're assuming he didn't know, that would have been amazing. Where he would have been like, I'll give myself this Epi shot and it's gonna reverse reaction and no big deal. Like, I'm cool. I have this shellfish allergy. I should have told you, but I was too proud to say it. That would have been cool too. But
then people wouldn't be able to come to you and say, I looked just like Will Smith in Hitch.
You're right. Just say, my throat was kind of sore, like,
it'd be like
Will Smith and Hitch. Now, if he'd gotten an EpiPen, would you have the same semi-zaniness from, oh my gosh, I've got tons of adrenaline running through me, as you would from Benadryl?
No, Benadryl is the down.
Okay.
Epi's an up.
Well, but Benadryl,
it would have been
the reverse Benadryl.
It would have been cut scene. It would have been end scene. He would be better, and there would be no other scene after that, I think.
I think them just calling 911, so it would be a
cinematically, it would have not worked.
There would have, there may have been some cinematic license with the whole.
I think it was better the way it played out because he didn't do that. Yeah.
Okay. Anything else to add on Hitch?
I really liked the movie.
I've only seen 2 scenes of it, and
you've
they were
really only seen 2 scenes.
This movie's
you have to watch the whole movie.
All right, but
it's great.
If I do, and we find
it in 10 years, I don't remember what happens. Like, how is he with her?
They fall in love.
And then he fights aliens.
Yes.
He fights aliens,
and then they dance. I think the end of it is they dance. Yes.
They fight aliens, and then they make you forget.
Like a jet.
And then they make you forget about it because they use a flashy
Why
thing.
is he with Ava Mendes? Is it like a joke or a dare?
No.
She's a reporter.
They meet at a bar.
Oh.
Yeah. But
she's dared to date him, right?
No. This is not a Hitch podcast.
This is not a Hitch podcast.
They meet at a bar and they fall in love. That's basically the short story of it.
Anyway.
More importantly, he eats shellfish.
Yes.
All right. And with
he
that,
almost dies.
And he almost dies. With that, thanks everybody for listening. We will be back on Tuesday with more Hi Everybody, a Bad Medicine podcast.